promises physicians take in the Hippocratic Oath is first do no harm. In my opinion, that can be subjective. However, this is a wildly controversial topic when discussing physician-assisted suicide. When we think about the word suicide, we often associate it with something taboo or shameful. However, when death is coming for you sooner than later, is suicide the answer? Are there other situations where suicide may be the answer? Today I'm going to talk to you about what physician-assisted suicide entails, the opposing arguments, and why life-sustaining therapy is accepted but physician suicide is not. According to the website titled Death with Dignity, as of January 1st, 2019, 6 states and Washington, D.C. have legalized physician-assisted suicide, and they are California, Colorado, Hawaii, Oregon, Vermont, and Washington State. Essentially, the idea is that terminally ill patients will be able to make the decision with their physician that they would like to no longer sustain their suffering and their pain, so that they can die peacefully and with dignity. The doctor would then prescribe them with a lethal dose of medication, which they would take over a course of time, thus ending their life under supervision. The Death with Dignity Act states that a physician will prescribe a lethal dose of medication to competent, terminally ill patients who request physician-assisted suicide, and that patient has to be at least 18 years of age or older, reside in that state where physician-assisted suicide is legal, and they should be able to make competent and their own healthcare decisions, basically. They have to have a terminal diagnosis with a prognosis of 6 months or less and make 2 oral requests and a written request. The written request must be signed by the patient in the presence of 2 witnesses, and the oral request must be separated by at least 15 days. The physician who prescribes the medication and a consulting physician must confirm the diagnosis and prognosis to establish the patient's capacity and that they are able to make their own healthcare decisions. If either physician believes that the patient is impaired, they must have a psychological evaluation so that they can make sure that they're not just depressed. So let's move on to the argument of what you may be thinking. Opponents of physician-assisted suicide believe that outlawing it appropriately keeps the focus on pain management rather than on death. They fear that assisted suicide will be misused and forced on the poor, the elderly, or the incapacitated. They also fear misdiagnosis will be eventually used for involuntary euthanasia. So let's just think about that for a second. They want to focus on pain management. I won't get into statistics about how much opioid abuse and pain management clinics we have in this country. And as far as the incapacitated, I'll just paint you a picture. I was a home health care aide for a girl who was hit by a car. She was just a couple of years older than me. She breathes through her trachea. She eats through her gastrointestinal tube in her stomach. She wears oxygen, and her body is so retracted and drawn up, there's no way that she's not in constant pain. But she has no way to communicate. She can't talk. She can't show expressions. She can't move very much. So how do we know? How do we know if this girl is in pain or what she's thinking or what she's feeling, if she's hurting, if she's not? She's mentally and physically incapacitated. Now, her parents are wonderful. They've literally dedicated their entire lives to taking care of her because in her state, that's what it takes to keep her alive. 24/7, they have to be there for her. They don't get a break, they don't get a vacation, they don't get time together, they don't get time for themselves. Now, at some point, they do find out that she has a terminal illness. Can they, as her parents and legal guardians, make the decision for her to participate in this physician-assisted suicide? Well, as the law sits, no, she can't. So she'll just have to sit there and suffer. Which brings me to my final point, which is WWLST, which is an abbreviation for withdrawing or withholding life-sustaining therapy. This life-sustaining therapy is anything that is intended to keep anyone alive, such as CPR, a ventilator, medicine, etc. This is also referred to as passive euthanasia. However, why is it socially unacceptable for assisted euthanasia? As the laws are for now, assisted suicide in the United States, patients cannot receive this without having a serious medical condition that will end in their demise. How are these two situations so far from each other that we cannot let somebody die knowingly, peacefully, and with dignity? We allow them this privilege when they're in critical care. We allow them or their power of attorney to make this decision. So why can't we allow them to know when they're fully aware and competent? I can sign a legal document right now without any sort of medical evaluation or psychological evaluation saying that if I'm ever in a critical condition, I don't want you to do CPR or put a ventilator on me or anything like that. So why can't we allow somebody to make that decision about their life when they're dying? Conclusively, physician-assisted suicide can be a wonderful option for those that are in need of it. It's not for everybody because everybody has a different situation and a different moral compass. But I hope that one day, now that you know a little bit more about the situation, you can show some compassion to a dying man or woman.